Hi, good morning, everyone. Thanks so much for joining today's webinar regarding the 2020-2021 CalMedForce application cycle with an open application period of August 7th through September 21st, 2020. My name is Robin Simpson, and I am the CalMedForce Program Director at Physicians for a Healthy California. My colleagues and I hope to answer all your questions today about the CalMedForce application, which funds graduate medical education residency positions. We have a lot of information to cover in today's webinar, and we'll have an opportunity to answer any of your questions today here at the end of our slideshow. If possible, please hold your questions for the end. All participants will be placed on mute during today's webinar. You may submit questions through the chat function at any time. Our team will monitor the questions and will address all questions at the end. Please note we are recording today's webinar. It will be emailed to our applicants and posted to our website, phcdocs.org, by the end of this week. We will hold the following live webinars during this application cycle, so please feel free to let your colleagues know if they missed today's webinar. They can definitely join us for a future live webinar. Anyone can sign up on our website, phcdocs.org. Here's our agenda for today's webinar. Joining me on the call today are my two colleagues, David Kurt and Max Hun, both program analysts here at PHC. You'll hear from both Max and David in just a few minutes. We'll walk through CalMedForce's governance, an overview of the program and the application, walk through the application process and steps, and also address some frequently asked questions regarding the application process. Once again, there will be time for question and answers at the end of our slideshow. Please feel free to submit those questions through the chat function at any time. And we always start with the mission of CalMedForce, which is right here. We're committed to growing a diverse physician workforce by supporting, incentivizing, and expanding graduate medical education in California. Our goal is to grow and strengthen the physician pipeline to meet the demands of California's growing patient population, with a focus on medically underserved areas and populations. Our governing statute is Proposition 56, which California voters approved in 2016. It was sponsored by California Medical Association, California Hospital Association, and Service International Employees Union United Healthcare Workers West. It was approved by voters and allocates $40 million towards graduate medical education programs to sustain, retain, and expand residency positions in California in primary care and emergency medicine. The University of California is the designated recipient of the funding and contracts with PHC to administer the program, which is called CalMedForce. This slide shows the section of Proposition 56 that governs our program. At the top, Part C states that $40 million will be provided to UC with the goal of increasing the number of primary care and emergency medicine physicians. The funds are to be used to sustain, retain, and expand graduate medical education programs. Part 1 defines primary care to include internal medicine, family medicine, obstetrics, gynecology, and pediatrics. Part 2 says funding is to be prioritized for direct medical education costs for programs serving medically underserved areas and populations. Part 3 states that all accredited allopathic and osteopathic residency programs in California are eligible to apply. Part 4 states that we are to conduct annual reviews of statewide physician shortages and that funds may be used to address such shortages in other specialties. CalMedForce's governance structure also consists of a board of directors and an advisory council. Our board consists of representatives from these 5 organizations: Physicians for a Healthy California, California Medical Association, University of California Health, California Hospital Association, and Service Employees International. And our advisory council consists of medical professionals and graduate medical education subject matter experts from these 15 organizations. The advisory council is involved in decision-making surrounding the application process, eligibility, awarding process, and monitoring. We work in close partnership with our advisory council and board throughout the year. All right, moving to award criteria. Once again, just to summarize what was stated in Proposition 56, eligible residency programs are located in California, either allopathic or osteopathic, primary care or emergency medicine. And once again, primary care is family medicine, internal medicine, OBGYN, or pediatrics. Programs must be accredited by ACGME, the Accreditation Council for Graduate Medical Education, by the time of contract execution, which for this cycle will be July 1st, 2021. And programs that are serving medically underserved population and areas are prioritized. Available funding by discipline is as follows. So these are our current sort of funding buckets. Family medicine, 9.5 million. And for internal medicine, OBGYN, pediatrics, and emergency medicine, there is 7.125 million available for each of those disciplines. The funding amounts may vary annually, and these are analyzed by our advisory council. Available funding by residents. So based on the number of residents and type of program, residency programs can request up to 5 positions. So funding by position is $75,000 per resident per year for new positions, $60,000 per resident per year for expanding positions, and $50,000 per resident per year for existing positions. And if you're not sure where your program may fall, we do, of course, have these definitions on our grant guidelines, which are posted on the website, which you can reference ahead of applying for the program. Combinations can be applied for. So for example, if you are an existing program, but you are expanding, you have some positions that are expanding, you can apply for a combination. So if you see the example here, residency program can request 4 residents that are existing and 1 resident that is expanding for a total of 5 positions requested. And this is just an example of how these may be combined. Dates to remember. So these are some important dates we want to definitely highlight. We do have an early application period. So the early application period is from August 7th to August 28th, 2020. So applications that are submitted during this time are reviewed by CalMedForce staff. So there's definitely a great benefit to applying between August 7th and August 28th. Our staff will review, let you know if anything is missing or incorrectly filled out. And we give those programs a chance to correct any errors on their application and resubmit. So that, once again, is only during the early application period from August 7th to August 28th. The application deadline is September 21st, 2020. So any applications that are submitted after August 28th, between August 28th and September 21st, are considered final and no changes can be made on those applications. So once again, we just encourage you to take advantage of that early application period starting tomorrow, August 7th through August 28th. Couple of changes. So if you're a previous applicant, you'll just want to take note of a few changes that are effective on this application. So first one is that we will be asking for 5 years of graduate data instead of 3. So be prepared with the 5 years of graduate data when you start your application. No more payer mix of the secondary site. So we'll just ask for the payer mix of the primary training site. And the third bullet point, potential applicants can apply now as long as they have ACGME accreditation at the time of contract execution. So if you're in that preliminary accreditation time period, you can still apply as long as you're fully accredited by the time of contract execution. So getting started, a couple more things just you'll need to know. First is that we accept electronic applications only, so no paper being filled out and sent in to us. It must be completed online. Each applicant must create an individual account with a username and password. So if you're applying for multiple residency programs, Each one will need an individual account with an individual username and password. If an applicant applied previously, you may reuse your username and password. And some of the information from previous years will carry over into this year's application, but not all. So you'll be able to see that when you log in. I also want to mention here that if you do not remember your previous username or password, the login page will give you an opportunity to retrieve those. Information on 5 years of previous graduates. So once again, that's just something that you'll want to have ready when you log in to begin the application, the information on 5 years of previous graduates. You'll also want to have your accreditation documents ready. We'll ask for the sponsoring institution letter of accreditation, as well as the residency program letter of accreditation. And once again, if you're not fully accredited, an accreditation letter of decision providing proof of formal accreditation by the time of contract execution. We will need that at a later date. Have that payer mix data ready. There's a question on your payer mix for the primary training site, and be prepared to provide budget information, the budget for your residency program, as well as the planned use of funds for the grant money. And at this point, I will turn it over to David Kurt, program analyst for CalMedForce, and he will begin talking a little bit more thoroughly about the steps in the application.
Thank you, Robin. So first, we're going to go over where to find the application. So there are many different ways you're trying to make it very easy to locate the application. But if we look at the picture here, a quick snapshot, you'll see something very similar. So we want you to visit phcdocs.org. And you're going to find CalMedForce under Programs. So there's going to be a sub-menu bar at the top. You're going to wave your cursor over it, click it, and it's going to highlight green Programs. Scroll down to CalMedForce. And it'll pop up another sub-menu with some places where you can view our webinars, some other items, including the application. But if you're unsure, go ahead and click CalMedForce, and it'll bring you to our splash page where you can click to start your application. All right, so midway down the page, I would like to point out that we do have a ton of application resources at your disposal. So everywhere from frequently asked questions, which is a very helpful document when trying to navigate the application. Also, your bread and butter will be the grant guidelines, which will give you all the detailed information and be kind of like a gamer's guide to making sure you complete your application. We also offer the blank application here, so you can take a look at what all the questions are ahead of time, so you'll be ready. And we also give you a sample completed application, so you can kind of understand some of the things we're looking for, and some definitions and things like that. So it might be useful to take a look at that so you know exactly what a complete application might look like. We also offer a sample agreement, and this is probably the sample agreement from the previous cycle, but it does give you insight. So I would suggest to take that to legal because the agreement is non-negotiable. We also have a web page that will hold all our webinars, not just the application webinars, but other things. So you might see awardee webinars here or other past webinars that might make it worth your while to kind of take a look at as you're filling out your application. So the other application resources, and we'll go the next couple of slides, we'll kind of talk about this in detail, but we'll have little eye icons or little circles at the end of words, though you just roll over those informational icons for additional information. And we also have our request help button, which if previous applicants will notice we had this our previous cycle, but it is a feature that allows applicants to send questions directly to CalMedForce staff and really streamline that process so we can answer them for you. So diving in a little bit of depth, so information bubbles are found throughout the entire application. What you do is you either hover over that little eye icon or you would click it. And so there might be words or a sentence that maybe you need a little bit more context. And so what will happen will be either a tan or yellow pop-up window, sometimes a white pop-up window, depending on your browser, and it will appear next to the word with relevant explanations or definitions. Now the help button will pop up a pop-up window. So your residency program should auto-populate here. And then your email used to create your username and password will go there. And then the other contact info will probably be blank, but you may add a different phone number or email address if you have something more readily available that you would like PHC to contact you back on. The other thing that will auto-populate is the step you're on. And then you can post your question below and then click send question. And what this will do is we'll know exactly what step you're on and what question you're asking. And so we'll have a good amount of context, so we'll be able to help you out with that. So here is just an FYI. You'll see this blue box, I think, throughout the application. So number one, you can move to the next step of the application by clicking save and continue at the bottom of each step. Now, at any time, you can return to any completed steps, but moving forward, it will require you to click save and continue to make sure your information is saved. So progress is saved each time you click save and continue, but if you click the back button, information will also be saved. And the best part is you can leave and come back at any time to continue from where you left off by logging in with the same account. Now, talking about the same account, you can only have one submission per account. So here it just reiterates that same information. What I like to do now is instead of offering a blank application, we have something called download my application. So depending on what step you're on, if you click download my application, it'll provide you a PDF of whatever information you had to fill up that point. So let's give you an example. If you were on step 5 and you completed it, press save and continue, and you wanted to take a look at your application, you'll download it. You'll see all the steps completed up to step 5, and then the rest of it will be blank. Speaking of logging in, we'll kind of go over it again. So you will click login and you'll have your username and password. So some people may have already been past applicants. If you are prior applicants, you can use your logins from previous cycles. So your username will be your email and then password, of course, whatever you use. If you are a new applicant, there's a little register button at the bottom. Go ahead and click that. If you need to reset your password, right next to the register button, that's where you'll do so. Also, what's also very helpful is I know I have a ton of logins and passwords. Sometimes clicking the remember login checkbox will just help make things easier if you have to come back to your application later. So here we go. Now we're going to start with step 1. So we're getting into the application, and all of us will kind of walk you through each step as best we can. So you'll notice they'll say see a preview of the sample, the blank application. So like I mentioned before, this will look slightly different. You'll download your application. It'll kind of provide you a blank one to look at. So with step 1, we want to know your eligibility criteria. The 4 checkboxes, the first 4 must be checked off, and then icing on the cake is if you serve the medically underserved populations and areas. And this is pretty much where you'll start seeing those informational icons we talk about. So you'll see it throughout the application. Once you click the appropriate number of boxes, go ahead and click save and continue. Now, let's say your program doesn't meet the criteria above, then what? So what will happen is a pop-up menu will pop up. It'll either expand on the bottom or it'll come up as a new window. If it doesn't meet the following criteria, but you think you're still eligible for whatever reason, please just provide a short, detailed explanation, and then CalMedForce will send a reply back, usually within 1 business days. During the application, if we have a high volume, we'll let you know if it might take a little bit longer. So either way, we will reach out with you in 1 business day, just so you have a response. Okay, so step 2 is we want to know how you heard about this funding opportunity. So we have a bunch of check boxes for you to choose. You only need to click one. You might only have to click one and that's it. And some of them, like say if you did emails, as it shows an example here, a next section of check boxes will appear and ask you specifically what kind of emails. And just to let you know, the data is only collected for internal purposes. And at this point on step 2, you'll start seeing that request help button at the bottom. So step 3, so we want to know the type of residency program you're applying for. So this is what we talked about, primary care or emergency medicine. We want to know if your program is allopathic or osteopathic, the title of your residency program. So if you applied in previous grant cycles, the cells will auto-populate once you stop typing or once you start typing. So it'll be semi-predictive text and a drop-down menu. Now, if you don't see your program here for whatever reason, you can always click Other and add it. And as for the same thing for the sponsoring institution. So sponsoring institution, you can probably type it out and give you predictive text or a drop-down menu, and you just click the appropriate one. So step 3, so continuing on, we talk about ACGME accreditation. So we need those accreditation letters. And so we want you to upload the most recent accreditation letter from ACGME for the sponsoring institution and the residency program. However, if you're not yet accredited, but you will be formally accredited by contract execution, we just need that ACGME letter providing proof of that future accreditation. So what I do like to point out here is you'll see these green buttons. It's like plus to choose file. Go ahead and click that. You're going to add whatever files you want. And what it's going to look like, it's already uploaded, but it's not quite. It'll allow you to remove the file. There'll be a red remove file button on the right of that choose file button. And at the very, very bottom, you must click the blue upload files plus button in order to proceed, because what's going to happen is once you attach everything, then you have to upload it. So I'll upload it for you. And so just to point out here, there has been a common mistake here where people are moving really fast and they're uploading like their sponsoring institution documents twice instead of remembering to add their residency program letter. So just make sure that when you do upload here that you're uploading the correct documents before you move forward. So step 4. So we want to know your program director and the program director's address. So the salutation, so you're an MD or DO, your first name, middle initial if you have it, your last name. We also want to know your address. And so we also offer, if you have a secondary email as well as a secondary phone number. However, these fields are optional, but if you just have multiple contacts, the more the better, because we want to make sure we're able to communicate to you guys effectively and as easily as possible. So continuing on to step 4, we also want to know the primary contact. So the primary contact, as well as the program director contacts, they have to be different. So the email and telephone number cannot be the same for the primary contact and the program director, right? They have to be different. And so we also want the address. We also ask for a secondary email and secondary phone number. However, those secondary contacts are not required, but it is nice to have if you do have an alternative way of reaching to you. So step 5. So right here, we're going to want to know your primary site, right? And we also want to know if you have a HPSA score. So if you don't know your HPSA score, you can find out by clicking the links. Not all residency programs, as you know, will have a HPSA score, but you can refer to the grant guidelines to figure out what it is if you don't know the exact number. And then what it looks like at the bottom will be like a little drop-down menu. You'll click the arrow, and it'll be like a white kind of scroll-down menu. Then click what score you may have. So step 5, continue. So here we go. We kind of talked a little bit about that HPSA score, right? So you can use that link above to find out if you're, to figure out what your score is if you have one. On the left, we want to know the location of your primary ACGME approved training site, or the primary site to which the majority of your primary care emergency medicine residents, FTEs, are providing care. So that's on the left. The middle is the HPSA score, and on the far right, we want to know the payer mix, which is composed of the primary site only. So I defined as Medi-Cal dual eligibles, which is Medi-Cal and Medicare, indigent or needy, uninsured, and other payers. And bottom percentage will always have to equal 100%. So make sure you have those numbers pulled for you. So another thing I would like to talk about step 5 is right under the name of site, right? You might have noticed practice setting, right? So we do have for a couple options for practice settings, such as the FQHC, Community Health Center, Academic Medical Center, Group Practice Hospital, but we also provide other because we know there are many different practice settings. So, please choose the one that identifies your training site for as best as you know or as best your ability, and that is sufficient. Now, here's a lot of words flying at you right here, so I noticed it's quite a bit, and these are our program types, or our new, existing, expanding. So this is how we identify those programs. So if we start out with a new program, we identify a new program as receiving ACGME accreditation for both the sponsoring institution or residency program, or we'll have a program accreditation at the time of contract execution. The other thing to note here is that you must not have graduated any residence yet to be considered a new program, but you will enroll at least one class by July 2021. Expanding program will kind of have two nuances here. So, so you have to be an existing residency program that received ACGME accreditation. You must have graduated one or more cohorts of residents, and also you will have additional category residency positions as evidenced by letters from ACGME approving for a temporary increase or permanent increase in the number of residency positions effective after July 1st, 2020. And we'll go a little bit into that on the next slide. The other way you can be considered as an expanding program is if you have residency positions that were not filled during the 2019-20 and or 2020-2021 academic years, but you plan to fill all or some of those category residency positions that were not filled yet in the 2021-22 academic year. Now, if you're an existing program, we're still happy to sustain the program. We just need to make sure that the residency program has received ACGME accreditation. The same definition applies, has to graduate one or more cohorts of residents, and you have to have the same or fewer number of filled residency positions in the 2020-2021 academic year. So step 6, so this is so now we're gonna go what best describes your program. So we went a little bit about the program types. So these checkboxes will reflect that. And expanding onto what we were talking about, expanding positions, if you have received ACGME approval for whether they're temporary positions or permanent positions, effective after July 2020, we need you to provide documentation. So the same way that you uploaded those accreditation documents, I want you to do it here too. So you're going to choose the file, attach the file, and then we need you to click upload. And that will upload the approval for expansion. And we do have an example right below. It looks almost identical as your other accreditation documents. So here in step 7, we got your program type. So these boxes will be automatically selected based on the answers that you provided us on step 6. So remember, maximum of 5 positions allowed, 75,000 for new, again, 60 for expanding and 50 for existing. Now, if you are an expanding position, if you're an expanding program, you can opt to do a combination, such as here we do that same example, 1 expanded position for existing, and make sure when you look at the duration of your residency program, make sure it is correct. So if you are a 4-year program, make sure it's reflected 4 here. If it's 3, make sure it's reflected 3 here, because that will affect what the total requested is. So just know that the maximum amount that you're allowed to request for is 5 positions. And so now what I'm going to do is I'm going to turn over to my colleague, Max, who will continue on for us.
Thank you, David. Hello, my name is Max Hunt, and I will be going over the next couple sections of the application. So the next 6 slides will go over information pertaining to step 8 of the application. Step 8 will request projected costs for residency programs for the academic year of 2020 to 2021. So please make sure to pull all of the costs for running your program into the boxes. Please also note the section labeled Other Costs will be calculated from a table below. This table will be shown in a later slide. So before we move on to the other portions of step 8, we need to explain the allowable cost for the CalMedForce program. This document is known as the CalMedForce allowable costs for the use of graduate medical education. This document will go into further detail what purchases are allowed with the CalMedForce grant. And if your program is awarded, we follow a reimbursement model for the distribution of funds. Additionally, grants must be used exclusively to support costs directly associated with medical education. But overhead costs are allowable and may constitute up to 10% of the grant award. Furthermore, Grants may not be used on items not directly related to their program. And there is a 10% cap of the total grant award for the purchase of medical equipment. For complete details, please see our allowable cost document. So now with the discussion of the allowable costs finished, we can go back to step 8. So this section of step 8 will collect information on how your program will use the funds requested from the grant to support your residency program. We know funding allocation may change during the course of the residency program, so this section will be used for internal purposes only. This will not serve as a binding budget if your program is awarded. So once the funds requested are completed, they will be auto-calculated. Please note the requested funds must match the total amount. Finally, for step 8, your program can list other costs for running your residency program. These costs can include things like licensing, match participation, other administrative expenditures for general items that support the operational needs of the GME program, and in-training examination fees. So step 9 will request information regarding the number of positions available and filled for the academic year of 2015 through 2016 through 2020 through 2021. Please note, if your program is new, you can enter 0 in the appropriate fields. So step 10 is a continuation of step 9. Please provide additional information on your graduates from 2015-2016 all the way through 2019-2020. Again, if your program is new, you can skip this step. Additionally, for step 10, if you have a different number of ACGME approved residency positions than filled positions, please explain why in the text box. Next is step 11. This is where general information would go if you were awarded the CalMedForce grant. Moving on to step 12. So step 12 is optional for your program to complete and ask if your residency training program has a diversity strategy. These can include things like a formal policy and training activities that explicitly aim to promote diversity in residency training programs. So if you selected yes for step 12, you can check one of the boxes that closely align with your diversity strategy. We have also included a text box where you can explain your answer. Step 13 is the submission step of your application process. Please read and check the attestations in this step before moving forward with the submission process. The residency program and date will auto-populate, but please note again, there is only one submission per account. And furthermore, once you click Save and Finish, you can review your application before submission. Additionally, after reviewing your application and scrolling to the bottom of the page, you can submit your online application. If you wish to review your application to make changes, you can do so by selecting No, Return to Application. Please note, once you have submitted your application, no further changes can be made unless you have submitted before the early submission deadline and the changes are deemed appropriate by the CalMedForce staff. Finally, once you have submitted your application, you can view your preliminary score and download a PDF version of your completed application. Now that we are done with the application, we can move on to the grant review process. There are several points to be made for this process. First, each application is auto-scored. Next, applications will be scored based on CalMedForce's scoring matrix. Please see the grant guidelines for further details. Additionally, applications are ranked relative to other applicants in the same specialty. So for example, if your program specializes in family medicine, then your program would be ranked against other family medicine residency programs. Next, CalMedForce has the option to award full, partial, or no funding to an applicant based on the applicant's score and ranking within their specialty. All applicants will receive their final score following the close of the application cycle. And finally, award announcements will be made in late November, early December 2020. So the following 4 slides will go over commonly asked applicant questions. The first question being, can I access my application to make changes or update after I submit? So unfortunately, no. Once you submit your application, it will be considered final and no supplemental information or changes can be made to the application once the application is submitted, unless you submitted before the early submission deadline. The next question is, what if the sponsoring institution has more than one program? So each program must submit their own application for consideration. For example, if your institution had both a family medicine and emergency residency program, then they must submit their own separate applications for the CalMedForce grant. Next, if your program was awarded last cycle, can they apply again for the cycle? So yes, if your program was awarded last cycle, you remain eligible to apply again for fiscal year 2020-2021. Other commonly asked questions are, so what if my program was not awarded last year? So we encourage all previous applicants who were not awarded last cycle to apply again this year if they are eligible. Next question, how are the applicants scored? So all applications will be auto-scored. There's a total of 30 points using the criteria and scoring matrix established by the Advisory Council and Board. Please note, you can find the scoring matrix in the grant guidelines for specific scoring details. And finally, who should apply? So we encourage all eligible programs to apply. Moving on to more commonly asked questions, what is the contract terms dates? So contracts begin July 1st, 2021, and would be for the duration of the residency program, and that would be either 3 or 4 years, depending on the length of your program. So if you're not awarded, is there an appeals process? So unfortunately, no, all award decisions are final, but with this in mind, we do strongly encourage applicants to submit before the early submission date so your program can make any necessary changes. And of course, please contact CalMedForce if you have any specific questions about your application. Next question, when is the first payment? So grant payment disbursements will begin in fall 2021. So this slide is the last set of commonly asked questions. So can there be contract changes? Unfortunately, no. The awardee agreement is non-negotiable. If you have any questions about the awardee agreement, please contact CalMedForce and we would be glad to answer your questions. What costs are acceptable under this grant? Per the Proposition 56 statute, costs must be related to direct medical education. As previously stated, we have created an allowable cost document with full details. Please see the document for more information. And lastly, why is it important to submit my application early? Applications submitted by August 28, 2020, 11:59 Pacific Standard Time will have the opportunity to edit their application if deemed necessary following staff review. Applications submitted after August 28, 2020 will be considered final and no supplemental information or changes can be made to the application. So we strongly advise because this will give an opportunity for applicants to correct any mistakes they think are impacting their score. Thank you for your time. I will now pass the presentation back to Robin.
Thank you, Max. Common mistakes that happen on the application, and Max just reiterated this one. We've said it a couple of times, so we really encourage you to take advantage of that early application period. Once again, it starts tomorrow, August 7th, and goes through August 21st, because during that time, we'll be reviewing the applications, and if anything is looking incomplete or not correct, we will give you a chance to correct it. So definitely encourage you to take advantage of the early submission. Another common mistake is just uploading duplicates of the documents or the wrong documents. So we will be checking for that during the early submission period. The accreditation, the step where you have to upload both the sponsoring institution accreditation letter and the residency program letter of accreditation. Oftentimes we're seeing the same document uploaded, so just being careful on that step, making sure you're uploading the appropriate documents in the right places. Not being clear enough in budget descriptions, so we would either kick back or possibly reject a application if there's not enough detail in the budget description. So do be as descriptive as possible. And not asking questions. We're available to you. Our staff and team is here, happy to answer any questions. So any time that you're not sure on a step of the application, don't hesitate to reach out to us. We want to make sure that everyone is being successful in completing the CalMedForce application. We wanted to mention the reporting requirements that are associated with this grant. So there is, of course, monitoring for compliance, as well as capturing successes and any challenges that applicants may be facing. So we do require 2 reports per year. This one is the first one is the semi-annual report and invoice. This is sent in late December, early January. And it will be sort of the mid-year check-in. How are things going? Are you still in compliance with the requirements of the grant? And showing us the use of funds to that point. And then the annual review is sent out in June and due by July. And that is the end of the year, capturing the impact of the grant funds for the year, as well as the use of funds up to that point as well. So we do keep account of the use of funds. So we will be, that's something that applicants and awardees will want to keep in mind, is that you'll need to be recording and reporting on the use of grant funds. In summary, so just some important things to take away from today, and we'll get to questions in just a moment. I saw some questions coming in, so we'll answer each of those in just a second here. So just in summary, our application cycle dates to remember are that we open tomorrow. So tomorrow's the first day, August 7th, we open up, so you can visit our website and start applying tomorrow. Early submission period is August 7th through August 28th. And our application cycle closes September 21st, 2020. Once again, I believe Max mentioned this, the funding announcements will be in late November or early December 2020. So just a couple months from now. Recommend and that you gather documents that are pertinent prior to the completion of the application. So we went through some of those documents in the webinar today, and then it's also listed on the website under the applicant resources. So you can gather those necessary documents prior to starting your application, and all those supporting materials that you may need. Once again, grant guidelines, sample contract, can be found on our website, the CalMedForce website at phcdocs.org. This is our contact information, so it's readily available to you. Our website, our email inbox checked daily by our staff, so this is a good one to keep in mind, CalMedForce at phcdocs.org, and our phone number as well. We will respond to phone calls, voicemails within 2 business days. You can probably reach us even more quickly via email. That's my recommendation there. And in just a moment, we'll move to our questions. Just want to capture our team's contact information once again on our call today. Myself, Robin Simpson, David Kurt, our program analyst, and Max Hun, our program analyst as well. Listening in today is one of our newer program analysts that you'll hopefully work with as well soon, Victoria Chesley. Also on the line is Jennifer Turner, our Senior Director of Operations, and we're going to unmute her to make sure she's available to assist us in the question and answers. So I believe now is a good time to have David review some of the questions that have come in, and we can all chime in on addressing each and every one of those questions. So may I turn it over to you, David, to review some of the questions?
Of course. It looks like we have 3 questions, so I'm just gonna go into descending order. So the first question is from Nadir. Can we get some information about payer mix? Is there a firm eligibility criteria about this? Thank you.
I actually have the grant guidelines open in front of me, so I can address this one. So this is a points-based question, the payer mix question. So you'll enter your program's payer mix. I think it's step 5. And depending on your percentage, your payer mix percentage, that will have a point value associated with it. So the maximum that you can earn in this section is 10 points. That would be if your payer mix is 81 to 100%, 8 points for 61 to 80%, 6 points for 41 to 60%, 4 points for 21 to 40%, 2 points for 1 to 20%, and 0 points for 0%. So this is just a question that would, you're more competitive, you possibly earn more points, the higher percentage on the payer mix. Once again,
Perfect. So on the next one.
Oh, sorry, just wanted to mention that I spoke kind of quickly there. If you need to reference those point values again, they're in the grant guidelines on our website.
So the next one is also a payer mix question. Lise Brooks typed out, what time period should we use to calculate the payer mix? Is it the past 12 months, the last calendar year, or some other period?
Very good question, Lise. We are looking for a payer mix, or the most current payer mix at time of submission. And generally speaking, we're looking for the academic year. So if you can try to pull a payer mix by academic year, that would be the ideal state.
Okay, so the next one is talks about program types, so specifically to a new program. And this is from, forgive me if I butcher the name, Nuodim. Can a program receiving funding under the new program category, if they were also funded last year in this category? This is for a program that is enrolling its first cohort of residents this year and has not yet graduated a cohort.
Very good question. Another good question. Yes, you can use the category new program type a second time. And the qualifying factor is that there's not a graduating class and we have not funded all of those positions previously. So our answer would be yes, you can utilize that category type a second time.
In the old application cycle, and this is also from Nadir, I'm going to make the safe assumption they mean the previous application cycle. We were able to report the payer mix for secondary sites. Would it be possible to include this information on this year's application? I can answer this one. Unfortunately, for this year, we will all be considering the primary site for your payer mix.
And if I can add some context to that, thank you, David, is we are, within our application cycle, we conduct numerous surveys and we do look at our stakeholders. There's also a governance process with the CalMedForce program in which we utilize those amazing folks in the advisory council and board, and there were several recommendations to nix the secondary site and focus on the primary site. And so based on that, in some dialogue and several subcommittee meetings, there was a change in the application cycle. So you are correct. This year, that is one of the fairly significant changes, and it was recommended from certain stakeholders as well as approved and recommended through the governance process of the advisory council and board. So to David's point, unfortunately, we would not be taking information from the secondary site, only primary site.
Right. The next question comes from Kelly Komada. If we are not approved by the ACGME for a specialty-specific residency program at the time of application submission, example, family medicine, Will the application allow us to skip the step in the application that requires a specialty-specific ACGME decision letter?
Now, I believe that is, if I understand Kelly's question correctly, this is the step where we're asking for residency programs to upload both the sponsoring institution letter and the letter of accreditation for the residency program specifically. So there is a space if you are in the process of gaining accreditation, you can upload that appropriate letter in that location. So notice of future accreditation. It might have a different name. Jennifer and/or David can help me out there, but there is a spot to upload that basically accreditation is happening, is in progress, and then we do require that the program must be accredited by the time of contract execution, which would be July 1st, 2021.
Mm-hmm. Correct. You should have a letter of confirmation indicating that the program is going through the process, and ideally, again, if you have it, so the requirement of eligibility is at signing of contract in July 2021, the program would have to be accredited.
Thank you, Jennifer. All right, David, any other questions?
There was another comment.
Go ahead.
No, it looks like just Ms. Kamada is just saying thank you. I don't see any other questions coming in.
All right, any other questions at this time? We'll wait a moment, see if anything else comes in. And of course, I do have, of course, our email addresses up here. And then our CalMedForce inbox is calmedforce@phcdocs.org once again. So please don't hesitate to reach out with any questions you may have. You can utilize that help feature to shoot us a message during the actual application process as well. So do take advantage of those resources available to you. We want to say thank you so much. We're very grateful to all of the programs doing such good work across California and working to address our physician shortage. So before we part ways, I'll just check with David one more time. Any final questions come in at the last moment, David?
No, Robin, I don't see any more.
All right. Thank you to my colleagues that helped out with the presentation today. And thanks again for everyone who was able to tune in. We'll have 3 other webinars coming up during the application cycle. So we have plenty of other opportunities to answer further questions. And I think did another one come in, David?
It was from Miss Gemma Kim, and she's just saying thank you.
Oh, thank you. All right. Hope everyone has a wonderful day, and we'll hopefully talk to all of you soon.